Good morning, Texoma, and thanks for joining us. I'm Ashley Fitzwater. This morning, we're taking an inside look at Hospice of Wichita Falls, specifically a new project they've kicked off called My Time Books. You may have already heard a little bit about it, but joining us now with much more is Frances Gibson. She is a volunteer at Hospice of Wichita Falls, and also Elisa Eccles. She is the executive director. So thank you both for being here this morning.
Thank you, Ashley, for having us.
Absolutely. Well, we're going to jump right into this morning, and there's so much to get to. Briefly, Hospice of Wichita Falls, you know, they offer care, hope, and support for families and patients, of course, whenever illness threatens a life, and a lot of times the place many turn to whenever it's, you know, for end-of-life care. And there's so many other programs, I know, that go beyond that whenever it comes to grieving programs for children and adults and family members. But this morning, one of those projects is the My Time book. And I love this. When I first heard about it, you know, we really wanted to share it with the rest of Texoma this morning. And Elisa, if you can just share a little bit more about what the My Time book is.
Okay. And Ashley, I think you touched on, we provide care, hope, and support when illness threatens life. And a lot of us don't know when that time will come. So we wanted to have a book, a resource, a tool available to patients and their families, so when the unthinkable happens, maybe they've had that conversation and they know what that loved one's wishes are. So this has kind of been a dream of ours for a couple of years now, and we finally got a team together and had Frances, who was gracious enough to underwrite this event for us program, so then we could make it a reality. So basically it's just a guide for people to have that conversation about what their wishes are regarding end of life. Also has a section in there so you could write maybe different passwords to your computer, what life insurance policies you have, how do you access those, checking account, savings account. So if something were to happen, your loved ones would know immediately how to access that information.
Why do you think that's so important for people to have ready to go?
I have a background in social work, so when I started at Hospice of Wichita Falls a little over 12 years ago, my role was a social worker, and unfortunately I saw that many times people weren't prepared. So when I was talking to them about maybe their mom's wishes, they had no clue, because that's not a conversation that's easy to have at the dinner table or at Christmas gatherings. Something none of us want to think about. So we thought with the My Time booklet, maybe that would force people to have that conversation. But I think it is very important just for the community in general. You don't have to be a Hospice of Wichita Falls patient to have access to this book. And I think that's the great part that Frances was gracious enough to. We ordered 5,000 originally, and then we were lucky enough to give those out. So then we got to order 5,000 more.
Wow.
So anybody can take advantage of filling out the book.
And there's obviously, you know, a desire to have more of these, because they've already ordered more. So we're going to take a closer look at exactly what's in the My Time book still to come. But, you know, the story behind this, as she was mentioning, is one we also want to talk about. And Frances, you know, if you can just kind of start with, why did you feel this book was so important to have in the hands of so many members in our community?
When Hospice called and asked me if I was interested in looking at a book that they were putting together, and told me a little bit about it, and just wanted me to come up and talk to them and look, and then ask me what I thought about it. And immediately I thought, this is what everyone needs, because of course Frank was a lawyer, and he saw a lot of people that at the end of life were left in not knowing what to do or where anything was, or that just needed help. And it was perplexing to come to a time when you need to have everything together and it's not there. And I looked at this and I thought he would be absolutely delighted to see all of this information, because we had talked about that many times. And even when he became ill, we talked about it ourselves. Because at one point I asked him, I said, now, do you have any surprises for me? And of course he laughed and said, I do. But I thought he would be very pleased to see this book, and how I just think it really covers everything.
And so Frank is your husband.
Yes,
And he
yes.
has passed
He
away.
passed away with hospice care.
This was a way, I guess, for you just to honor his memory.
Yes.
Correct?
Yes, it was. And I thought, what a great way to do it. Something that really followed his line of work.
Yeah.
And also I knew how hard it was a lot of times when people didn't have the information. And this would be a good way to spread the word.
Absolutely. It sounds keeping his memory alive through something he did every single day, you know,
Yes.
helping others. So
Yes.
sounds perfect, absolutely. Can you talk, though, I know your role goes even deeper with hospice. Not only, you know, was hospice there for you at a time, you know, whenever your husband was passing, but you have been so involved with hospice. So can you tell us what this nonprofit really means to your life personally?
Oh, hospice means everything to me. It has been my life for the last 25 years at least. I started with the boards, and they needed someone to help in medical records. So I went to work when the little hospice was over on Kemp Street in a little house. And then we moved out to Johnson Road. And, of course, we began to grow. When I started, we had 15 patients. And
Wow.
now we've grown to 236 patients.
Wow.
I've loved every minute of working there. And it was fun. People don't understand that. It was fun and educational, and everyone has their story, a story to tell, and I think that is what is so rewarding. And then when the time came when my husband, they diagnosed him with lung cancer, and he was still working and doing great, and then when the time came that he didn't need any more aggressive treatment, we came home from the doctor's office, and I asked him, I said, Frank, if something were to happen and you fell and I couldn't pick you up, it would really be nice if we had hospice. What do you think about that? And he loved hospice too. He was involved in it as much as I was with all the extracurricular activities that hospice had. And he said, call them. And I had really worked for a couple weeks or a month on how am I going to present this. And I said, well, I think they're at lunch right now. And he said, that's okay, they'll come out anyway. And it was lunchtime, and by 2 o'clock they were there.
Wow.
And he loved their coming. In fact, on the days they didn't come, he was very disappointed. And every one of the hospice employees were so wonderful, and it made the transition so easy. And then he was in the center for a week, and that was wonderful too, because everyone who had come to the house came out to the center to see him after they were off work. You know, I've seen hospice now from every side. I've seen it from the very beginning in a little house and see it grow through the years, and how the community has supported hospice. That to me has been the most wonderful part of all, that it's a community hospice.
I think we're very fortunate to call Francis and Frank both friends of Hospice of Wichita Falls, because they have been very involved, big supporters of us throughout the years. And we were very sad when we lost Frank, but very honored that they called us in to be able to take care of him during his last month or so. And I remember that day that I called to check on him. I said, Frank, is there anything we could do differently or do for you? And he said, just if you bring out that magic pill. So I remember Francis, him saying that.
So again, just another tie that it shows how neat and important the connection is, you know, to his memory, of course, in these books. And they, I know, continue to help so many families. Already 5,000 of these books passed out. They have ordered more. In Texoma, as they mentioned earlier, you don't have to be, maybe even have a connection to hospice to receive one of these books. We're going to tell you much more on how you can pick one up so you can fill one out and have them for your family members after the break on News Channel 6 Inside Texoma. Welcome back to Inside Texoma. Once again, we're taking an inside look at Hospice of Wichita Falls, specifically a project that's underway called My Time books. And really, these books, They're free for the community, and they've already passed out 5,000, and they have more that have been ordered. So Texoma, they are open for everyone. And you know, what a neat thing. This is something that they are providing for you to really get everything in order in one location, in one book for your wishes. You know, should you pass away or there be a death in the family, everything's all together in one location. And we've heard a little bit about Frances's story and her husband, and really how important it was for, you know, her to keep his memory alive through these books, and I know helping so many Texomans. But these books, you know, we were talking during the break, and really anyone 18 and over, you said, this is something that's really good for them to pick up, fill it out, just have it already done, and an easy conversation starter, because like you mentioned, it's something no one ever really wants to talk about. But, you know, looking through this book, it's not threatening. If you really just look at it, it's kind of like you're filling out paperwork for anything, and it just lays it all out for you. And a great thing maybe just to do with your spouse or your loved one, right? Would you recommend just kind of getting all together? Or?
Yeah, and I think the good part about it, too, is you can do it at your own pace. Mm-hmm. I mean, yeah, you might want to do it every night, or maybe not, just once a month, get it out. We would recommend you do it in pencil, because things might change over the years too. Maybe passwords might change, but maybe your wishes might change too as you get older. So I think it's important. But if you do it in pen, and in a couple of years you want a different one, call Hospice of Wichita Falls. We'd be glad to give you another one. But you can just work at it on your own pace. I mean, maybe you want to start in the back, or maybe it's the middle section that's easier for you to start. But yes, I think just I think everybody's different. Mm-hmm. It might be at a family gathering where everybody gets together, or it might just be you individually that you just want to take some time to read over it, think about it, and then come back a few days later and write down, you know, what your wishes really are.
And Elisa, I know flipping through here, you can maybe feel a little overwhelmed. I think it's laid out very neat, but there are so many people who are willing to help support, walk you through this process. I understand you even go out in the community sharing more about this. Can you explain more of that?
Sure. We have licensed social workers there at Hospice that would be glad to walk you through this. If there's a part on there about advance directives, maybe you have some questions about how to complete those forms or anything in the book, please just call us, and we'd be glad to get you in touch with the social worker to walk you through, come out to your house, you come there to our office, and just talk a little bit more about that. Yeah, that's how we've given out more than 5,000, I think, is we've had different churches, different organizations that's called and said, what's this thing about the My Time book? But we want to know more, and can you come to our group? And of course we would love to. There's also a short video that we usually play with it that goes along that talks about end-of-life care and just some wishes there, and I think it's a great little video. So we usually show that and then just talk a little bit about the My Time, and of course allow any time for questions at the end.
What are some things that maybe you could point out in the book today just to let people know this is in here, this is something that could be beneficial? Make sure you take a look at this.
Okay, I think one of the parts that I really like is just the part about the funeral memorial wishes. Again, that's something that nobody wants to talk about, but I think it's important to know, does your loved one want to be buried? Do they maybe want to be cremated? So it's a good way to have those conversations when you fill out this booklet. Who are your pallbearers? What do you want talked about in your eulogy? Who do you want to deliver your eulogy? And then it even has a place where you can write your obituary if you feel like you want to do that. Some people might not, but some might. It also has a checklist for the survivors. That's something at the time of death, most people are usually emotionally, physically drained from taking care of their loved one, or maybe just from the shock of the death. So it gives you a checklist to make sure you haven't missed anything. Frances was saying, you know, they had everything together or thought they did, but just to make sure you have everything together in that. And then who do you contact to get like the death certificate and different information like that. So it has a section just on that for the survivors to look at.
Definitely a lot of great points. Frances, what stands out in your mind? What seems to be one of the most beneficial things that you found in the book?
There have been so many things in here that I did not even think about, like having all the financial information in one place or the personal property. Every time I go through the book, even now, I just think, oh, if I had had this and had all our computer passwords in one place. And say, we had really talked about it and had time to make our plans, but I think no matter how much you're together, when the time comes, there are always questions. But as I looked through this and went through it from the first time they showed it to me, I thought, oh, this would have been so beneficial. Mm-hmm. And it still is beneficial because I'm taking advantage of it now.
Yeah.
And I've given one to each of the children.
Absolutely.
And friends. And it is amazing how many people, after it came out after our volunteer appreciation banquet when it was first announced, how many people really wanted one. And came and asked for it, where I was reluctant at first because I didn't want to be pushing.
Right.
And you never know. I didn't want them to feel like I thought, well, you need hospice. Mm-hmm. But I think everybody needs this book. And there is no charge to anyone for it.
And I think our goal with Hospice of Wichita Falls throughout the book is really just, if you have a loved one that is ill and close to death in the final stages of life, that they really have that opportunity, and you have that opportunity just to be with that loved one and not be worried about a lot, or at the time of death that you can grieve that loss, or be with other family members that maybe have come in out of town, the people that you love the most, and not have to worry about things. So if we can do and have some of these conversations ahead of time, maybe then at that time it'll make it a lot easier on people.
So well said. Well, thank you, Elisa and Francis. We are not done talking about the My Time books. We need to take another quick break, but we'll be right back with more. Stay with us. Welcome back to Inside Texoma. Once again, we're taking an inside look at Hospice of Wichita Falls with a specific focus this morning on the My Time books. And Elisa, you were just kind of talking during the break how this book is also in Spanish, which I think is great. Lots of opportunities, again, to reach more and more families in Texoma.
Yes, and that was, again, what Francis had generously agreed to pay for, is for us to do a couple thousand books in Spanish, too, so anybody who would need this book could have it.
I think that's wonderful, and much more on how you can pick that up, of course, and where you need to go to do so in just a minute. But first, in case you're new to the area or you're just not sure exactly what all hospice offers, because like we mentioned, not only do they offer that care and that support, but I mean, it just goes so much deeper than I think many realize with the grieving program. So, Elisa, can you just share what it is that hospice does?
Okay. Really what we want to do is just add quality to people's life when a cure is no longer an option for them. We service 12 different counties.
Wow.
We go out to people in their private homes, of course, but even we contract with about 26 nursing facilities, so we can take care of people in the nursing facility, assisted living facilities, and then in our 12-bed freestanding inpatient center that we have. We have a team of professionals, from our physicians to nurses to our certified nurses, aides, licensed professional counselors, social workers, chaplains, our wonderful volunteers. So it's not just one person that we look at to be the expert to talk to those patients. It takes really a team of us working together to help not only the patient, but the family members and their loved ones are really important too. And that's through just a lot of different services like you talked about. We do offer bereavement services to people at least a year after the death, and that's open to the community at large. So any of our support groups, anybody who's listening today who has lost a loved one, maybe it was a sudden death, are available. And I would just encourage you to call our office. Our number is 691-0982, and just ask to talk to someone in our bereavement office, or our licensed professional counselor will be available too. We have Camp Groningen coming up next week, which is our children's grief camp, and that's been going on for several years, and that's just a way that we can help kiddos that have lost someone significant in their life. And camp is for kindergarten through 8th grade. We have over 50 kids already signed up for that. And again, their loved one wasn't necessarily on hospice services, unfortunately some, maybe it was suicide, a car accident, a sudden heart attack that they've lost. And I couldn't imagine being, in kindergarten, first grade, and losing my mom or dad or my sibling. And our goal in that program is just give them the tools to be able to go on with life. And 5 years, 10 years down the road, kind of having those coping skills so they can be able to, like I said, just go on with their life.
And we have heard some amazing stories, from family members who are on recently. If you'd like, you can go back online to newschannel6now.com and hear some of those stories. Just click on the Inside Text Homa link. I know Peyton's story, we talked a lot about that and really how the Camp Grin Again helped her family. And I think it's interesting because a lot of people may not realize that you don't have to have had someone in hospice care to take advantage of those programs because they're there for the community. And all of this, Elisa, I think is important to mention and keep in mind. The reason you do the campaigns and the funding is because a lot of these patients may not have to pay anything, correct? Can you explain? You're not turned away if you cannot pay,
right?
Correct?
And our mission statement is care, hope, and support for all when illness threatens life. And unfortunately, we're seeing younger patients, so they might not have Medicare or Medicaid or might not even have private insurance. And we want to give everybody the same care as maybe the people that live in the mansion, here in town.
Sure.
And we really don't discriminate against. You really wouldn't know, their lifestyle. We don't put anything on their chart that, says that they're a non-funded patient.
Right.
But just last year, we provided over $430,000 in care to people that didn't have Medicare, Medicaid, or private insurance. And that's through the generosity of this community that we live in, that we're able to do that, to reach out to anybody and everybody who needs hospice services.
And the Tree of Lights campaign, of course, near Christmas, you see it. That'll be a big one. We always like the big star on News Channel 6, and the kids raise lots of money at the school. So make sure you stay tuned for more on that as we get closer to December. Believe it or not, it'll be here before you know it. So, but that's a major fundraiser of hospice, and so every little bit that you can give helps these families. And, Francis, we just appreciate what you've done for the community. I know a lot of families out there are going to benefit from these books, and, what a great way to keep your husband's memory alive and continue helping what she did every single day. So thank you for that.
You're welcome.
And Elisa, thank you for sharing this morning. We appreciate it. And if people would like to learn more, you have a website that they can go to as well, correct?
We do. It's hospiceofwf.org. And I would just encourage anybody listening to not wait till it's too late to call, because still the number one complaint we get is, gosh, I had no idea what all you could offer. I wish I would have called sooner. And unfortunately, about 50% of the patients that we take care of, we only have services for less than 2 weeks. And to be on hospice, it's a prognosis of 6 months or less. So we want to be able to take care of people longer because we know the benefits that our team can offer them. So just call. We can always just talk to you about what we can offer and do an assessment. So that's what I would encourage.
All right. Well, again, thank you both for being here this morning. We appreciate it. And Texoma, thank you, of course, for joining us as well. If you'd like to pick up one of those books, you can always stop by Hospice of Wichita Falls. Give them a call. Again, they are here for you and your family to help you have everything in one location, the My Time books. Well, thanks for joining us this morning. We hope that you have a wonderful day. As always, we'll see you back here next Sunday morning for another look inside Texoma.